Hey warriors, welcome to our unit on therapy. Now, therapy throughout history has been the history of helping people with psychological problems. Therapy in the olden times used to be downright heinous, but people were at least trying something. So if you take these pictures from the top left, you see a man in a swing and he's being circled around and getting all dizzy. And I suppose this was supposed to help him. In the top right, you have a man with a VR virtual reality theory thing on his head. He's looking into the future and seeing a better future for himself. No, that's a complete lie. This was created by Benjamin Rush. It's called the tranquilizing chair. It's supposed to calm people of their mania. And the thing on the bottom is called the crib, where they would put violent clients, and it looks downright scary to me if you were there for a prolonged period of time. Now, on the bottom right, you have a woman screaming her head off in a straitjacket, and that's still in use today. What therapy is a variety of approaches that mental health professionals will use to treat psychological problems and disorders. And although there's many different types of therapy, all the approaches fall into two basic categories, and those are psychotherapy and biomedical therapy. Now, psychologically based therapy, or psychotherapy, involves verbal interaction between a trained professional and the person, who is usually called the client or the patient. This is the person who is seeking help for psychological problems or to achieve personal growth. It doesn't necessarily have to be because of a psychological problem. I've seen therapists in the past who have helped me do just that, and that is to achieve growth. Biological or biomedical therapy involves the use of drugs and other medical procedures to treat psychological disorders. Not all procedures involve drugs. Some therapists combine the techniques. A person can receive psychotherapy and then from a psychiatrist, they can get medications to control mood swings. Half of all psychotherapists describe themselves as using an eclectic approach, which means a combination of different treatments, and that might be combined with medication. Now, the preference depends on the person, their preferences, their financial circumstances, and the time available for treatment, and the therapist's theoretical and medical approach. There are hundreds of specific methods for psychotherapy, and most of them fall within the categories of psychodynamic, phenomenological, and behavioral. The general goal of treatment is to help people change their thinking, their feelings, and their behavior in a way that relieves them of the discomfort and to improve their overall functioning. Remember that the goals of psychology are to describe, explain, predict, and control human behavior, and therapy is a way that we learn to control behavior. If the goals of psychology are to explain, describe, predict, control human behavior, then the goals of psychotherapy include gaining new perspectives and helping to improve a client's expectations. Now, this is developed through a trusting relationship, and that is with a mental health professional. Now, giving people hope for recovery is important, because most people who seek therapy have problems they believe they cannot handle alone. They may have low self-esteem and lack confidence to recognize that their situation can actually improve. So just that belief that therapy will make them better is enough to put many people on the road to recovery, and it's known as the placebo effect. That is not the only thing that's going to help a person, though. It's one of the most important factors in treatment, the belief that they can get better, that they can change. It influences the hopes and the expectations that they can improve their environment, but it doesn't come without work. So the therapy goes beyond just the placebo effect. It combines the client's belief that they can change with hard work and professional guidance. It's not enough to believe that you're going to get better. What you have to do sometimes is just change thinking and thoughts. And that's where the trusting relationship with a professional is so integral. It allows the person to see things from a new perspective and different options. For example, if there is a person who is depressed and they cannot seem to find a way to reframe their thinking that life is always going to be this way, then the therapist will approach that with answers to those problems. They can give them a more positive outlook and help to rise in their self-esteem. A person who is afraid of phobias can be desensitized to that object what gives them fear by working with another professional. Now, there are lots of different types of therapy, and we're not going to go into all of them, but most of them do use that eclectic approach where they blend different ones. We'll stick with the major theories, and these are the psychodynamic, the humanist, the behavioral, and the cognitive approaches. And most of these techniques can be done one-on-one, the therapist and the client, or a small group. Each of these methods has a different goal and a different way of handling the goal. And some psychotherapists use just one, but others use the eclectic approach. So when it comes to therapy, there are different options. You can handle it one-on-one, or you can go to group therapy. One-on-one is a really great option because you have the more personal attention, and then you get really comfortable with that person who you're working with. But if financially a person can't afford that, then they can choose a group option where there's oftentimes free options. So groups is like living in a social lab, and you can explore social behaviors and develop social skills. Now, the best example I can give you is like an AA meeting or a Narcotics Anonymous, Overeaters Anonymous, Sex Anonymous. There's hundreds of anonymouses, and those are group focused. This allows a person to share with people who are going through the same things that they have. They have similar problems, and you find out that you're not alone. And a lot of times in those meetings, the worst thing that you think you ever did, you share that, and somebody says, "Oh, wait, hold my drink." Because it's not a beer, because it's alcohol. Hold my drink. I've done something worse than that. And it kind of gives you permission to not feel so bad about yourselves. You also get immediate feedback, and you get everybody on your side. This saves the client money because you're not spending it on a one-on-one consultation. Overall, group therapy is a great option for somebody who's not looking to spend a bunch of money and has the time to go to meetings like this. But the other option, of course, is things like family therapy, group therapy in a family setting. So that's an option too. Overall, there's lots of options for therapy, and we will explore many of them in the coming week.